answering question 2 on page 247. I'm currently in a transition to practice program, so I thought it'd be really interesting if I could research the pros and cons to this. I didn't actually know that this was a new program. I thought that it had been going on for a while, but I definitely see the benefits of it. I wasn't entirely positive on what the cons were. So I think the transition to practice program was very beneficial to me as a new grad. There were many things I wouldn't feel comfortable performing without a nurse by my side. It was nice to know that I always have a point of contact. If I ever need anything, if I can't get the IV stick, if I'm not sure what a lab means, I can always run to my nurse, and she's like my one person to go to that I can always ask questions, and she can point me in the right direction. And I've just begun taking the full patient load on my own, so I think that having someone that you can split the patient load with for the first couple of weeks is very beneficial, because you're not always ready to just take 4 patients automatically coming out of nursing school. Alright, but on page 234 in our book, a rationale for these programs are given. Programs are for new RNs to allow work and class experiences during the transition period from a student to a nurse. There are many types of programs depending on where the nurse is hired. Some begin before the nurse even graduates from nursing school, and others last over a year. Mine currently is only 6 months long. I know there are a couple of programs for super intense areas. The two coming to my mind are OR and ICU that have a year to 2 years of a program. But they ensure that new RNs are prepared for their role in their hospital. It increases patient safety, and it also works to decrease turnover and burnout in new nurse populations. These two, especially the last two, I think turnover and burnout have been very important in the creation of these programs for me in particular, because I don't think that I would be able to go into a hospital environment and immediately take on the full patient load without feeling overwhelmed. But NCSBN studies of transition to practice programs show that they're most effective when it's a formal program that lasts 9 to 12 months, when you have a preceptor available per nurse, so you have that one point of contact, and when the focus is placed on patient safety, communication, evidence-based practice, and clinical reasoning. And the program also has to be individualized to the unit that you're on. So if you're in the emergency department, you should be focused on emergency medicine rather than when you're on the cardiology department. You should focus on EKGs and rhythm interpretation and how to take care of someone with a heart attack. So it needs to be very individualized per unit. So the cons to this, well, first of all, another article proposes that first-year nurses have a turnover rate of 35 to 60%. However, after the implementation of a transition to practice program, those rates dropped to 26% over the first 2 years. So there was no data on what the number was the first year, but over 2 years it was still less than the first year alone. 50% of nurses miss subtle life-threatening changes in patient condition. I actually experienced this yesterday, which was really scary. A patient was having a heart attack, and I had no idea. They were having a stroke when they came in, and the person who did the EKG didn't mention to me, like, oh, there's ST elevation at all. So I found out when their labs came back and their troponin was sky high. So I thought it was crazy that I could just miss all of the clues of the heart attack because I was so focused on the stroke. So it was nice to have my preceptor with me to be like, okay, this is what we could work on. They ended up fine, so it's okay. But when paired with the preceptor, novice nurses are able to learn about these subtle cues and practice safely inside of the hospital environment. That was extremely beneficial to me to have that nurse to go to after that had happened. But cons to this program include that it's not standardized. Like I mentioned earlier, programs can last from a year to 6 months. They can start before you graduated, before you get hired, after you get hired. It's really dependent on the hospital system. The fact that they aren't standardized leads to a lot of questions as to what new nurses are learning and if new nurses are being prepared as well as they could be. in one hospital versus the other. There needs to be consistency in bridging the gap between school and work. This calls for a quality of education and full understanding of the expected outcomes of these programs. Another downfall is that there's not enough funding for these programs. Many hospitals already are hiring nurses who have gone through their transition to practice program and passed it successfully. This program, or those would be the hospitals that start transition to practice programs like during the last year of nursing school or before you get hired, so that you get hired on and you know more about the hospital environment before they come up. Medicaid has been called into question if we should be distributing these funds to the transition to practice program instead of currently they're being distributed to diploma nurses in like more rural settings in order to keep nurses coming in. But I believe that we should be pushing for nurses to have higher education, not just a diploma. Stuff like BSN, MSN, they should really be pushing nurses towards that higher education so that we can be preparing for the nursing shortage and giving our patients the best competent care. So I believe that Medicaid money would definitely benefit new nurses coming into the practice. And I personally would not want to pay for the transition to practice program just because I've heard how expensive it is. But if I had to pay in order to get hired on it, I definitely would. But I think I'm very blessed to be in a hospital system that pays for that for me, so I can get the full educational benefits of going into the emergency department and not feeling like I'm going to kill someone every day. Thanks.